Hello everyone. Do any of you or your relatives or friends have ever been diagnosed with squint for which they were advised to go for squint surgery and with which still you are into a lot of dilemma with? Then hopefully today's video will help you to clarify most of your doubts and will help you to make your informed decision about squint surgery. I am Dr. Prajna Ghosh, pediatric ophthalmologist and squint specialist at Narayana, Nethralaya, Bangalore. In my previous video, I have thoroughly discussed about what is squint and what are different treatment protocols of it. So in today's video, I will mainly be focusing about squint surgery per se. So in this video, I am trying to answer few of the questions and few of the misconceptions that I normally come across in my daily practice. So to start with, first question comes from my patient is, Doctor, is it not possible to correct it without surgery? So yeah, my answer is yes, but not always. There are some situations, some scenarios, like if the squint is small in magnitude, if it is intermittent in nature, like squint is not seen throughout the day, only when patient is fatigued, patient is tired, not paying attention or not physically well, only those few times you can see squint for the patient. Those time, yes, we can improve this squinting tendency by conservative methods like some eye exercises, prism glasses, vision therapy, all of that. But if squint is constant, like it is seen always throughout the day and it is large in amount, then there is no other way. Then surgical correction only can help you to fix this squint. Second question comes, Doctor, is it safe? Is it safe to go for the squint surgery? Yes, the answer is yes, because to answer this question, I will just tell you how we operate for this squint. So we have small muscles, we call it extraocular muscles, which are moving our eyeball left, right, up and down. So if some of the muscles underact or overact, then only eyes turn in or out. So squint surgery is nothing but loosening the tight muscle or tightening the loose muscle. So in order to do that, we remain outside the eyeball. We don't go inside the eyeball. So in that, considering that, comparing to the other eye surgery, squint surgery is very safe. But definitely there will always be a minimal chance of few complications, but you don't need to worry about it. Even if that happens, any squint surgeon is educated enough, trained enough to take care of that, so that in future, in the long run, patient will not have any problem. Third question comes, Doctor, will it correct 100%? Is there any guarantee that it will be 100%? So see, again we try to correct it 100% and most of the time we are successful to correct it 100%. But few percentage it will be like that you will not feel it is not properly aligned. Little bit chance of under correction, over correction will always be there. But even if that happens, that will be very small considering your original squint, and in case of that also, after surgery also, we can take care of that problem with some eye exercises or special kind of glasses, all these things. So in the long run, usually patients do not have any problem. Third question is, Doctor, will it come back once again? Like what about recurrences? So if a patient has good vision, good corrected vision in both the eyes, and after the surgery patient is ready to wear his number glasses and do few of the eye exercises, usually this chances of recurrence of squint is very less. But again, if the vision is less, yeah, chance of recurrence increases a little bit, and then we need to take a call. So all these things are there. The next question comes for the children mostly, Doctor, what is the best time to go for squint surgery? Again, there is no magic number, and each and every squint is different from each and every patient. Especially for children, if the squint is hampering vision, like if due to the squint vision is getting deteriorated, then as early as better. Then we are in a little hurry to get it operated, and the early you do and you start your child with patching treatment or other amblyopia treatment, the vision improves fast. And not only the vision, after correcting the squint, like after making your eyes straight, slowly the child gains back the binocularity, means 3D vision, depth perception, stereopsis and visual field. So other qualities of vision starts on improving. For adults, again there is no urgency, but again the early you do, all these visual qualities starts improving. Now regarding the surgery, the next common question I face, doctor, will it pain or not? So see, no, absolutely not. There will be no pain because we work with a very good anesthesia team. For children, we give them general anesthesia where we make them completely asleep. So child don't get to know about the surgery and they don't experience any kind of pain. For adults, we give a local anesthesia, like with 1 or 2 injection, we make the eyes and the surrounding area completely numb. So even though patient remains awake, they don't get any kind of pain. This surgery is a daycare procedure, so just morning you will have to come in the hospital, get your surgery done, and after few hours of observation, you are allowed to leave. For follow-up, few times we will call you back just to see that the wound is healing well or not, and few eye drops and ointments will be there to apply in your eyes. And any kind of pain, redness, if it happens at all, your treating doctor can take care of that. Another question I get for adult squint, because most of the time I get to see adult squint with a high refractive error, high glass number. Doctor, if I get my squint surgery done now, in future can I go for any other refractive surgeries to take off my glass number like LASIK or not? Yes, undoubtedly yes, because I will be working, squint surgeon will be operating outside your eyeball, and refractive surgeon or LASIK surgeon will be working inside the eyeball or the black portion of your eye, that is cornea. So where we work, those spaces are completely different. So you can get your squint surgery done, after few months of gap you can go for your refractive surgery, or vice versa, you can go for your refractive surgery and later on you can go for your squint surgery. None of them are going to interfere each other. So I think now with this video I have been able to clarify some of your doubts and reduce your unnecessary fear and anxiety level about the squint surgery. And if squint surgery is advised by your squint consultant, they must have taken the decision after considering many factors. So now I think you can take your informed decision about your squint surgery. Thank you.